Welcome back. New research out of England shows how acne can increase the chances of depression by 63%. Dr. Ted Lane from Sonova Dermatology is here today to tell us more about this and talk about the study. So thanks for joining us.
Yeah, absolutely. It's great to be here.
So briefly tell us what this study is about.
So researchers in England looked at well over 1 million people. England has a single payer system, so they're able to follow people within their healthcare system from birth till death. And they looked at so many people with acne and whether there was an increased risk of depression for those with acne versus those without. And they found that to be absolutely true. Wow. Those with acne had a greater than 50% risk of developing major depressive disorder, especially within the first 12 months after the diagnosis.
Wow.
This is incredible because it talks about what we have known for a long time as dermatologists, that our patients suffer with acne not only because of what it does to their skin, but also what it does for them emotionally. And it points to the fact that it is so important to treat acne early and to continue treating it throughout adolescence and into adulthood.
Speaking of adolescence, you know, acne is commonly associated with teens, but adults can have acne as well, right?
Absolutely. In fact, the majority of patients that come into my office for acne are adults. Well over 60% of patients that come into my office for acne are adults.
And so the correlation here with depression and the common, side effect, is it just because you don't feel good, you don't feel, that positive about yourself, and maybe that bums you out? Or
well, absolutely. I think when you look in the mirror and you don't like what you see, you lose your self-esteem, you lose your self-confidence, and then you just don't put your best self forward.
So I know you brought some products here, over-the-counter products. What would you recommend? Because sometimes they can be so expensive, but some over-the-counter products aren't too expensive.
The major breakthrough in the major breakthrough in over-the-counter acne treatment is this right here. It's called Differin. It used to be available only by prescription. It is $18 for at least a month's supply.
Where do you buy it?
You can buy it anywhere.
Really?
It's available, it's widespread, and it is used for both the blackhead and whitehead type acne and as well as the pimple and blemish type acne. It's used once a day as a thin layer over the entire face. It plays well with others, so you can use this along with, for example, a benzoyl peroxide wash. Benzoyl peroxide, I've also included some products with salicylic acid. Those three ingredients are key to an acne regimen, especially for those who suffer from both the blackheads and the pimples, which are different types of acne, really.
What if you want to do something like do-it-yourself, DIY, you have a bit of a concoction?
Yeah, we put together a little concoction. It's very simple. It's some steel-cut oatmeal mixed together with Greek yogurt and a bit of honey. So the Greek yogurt has the lactic acid, the honey is anti-inflammatory and antiseptic. So it all works together along with the oatmeal, which is calming, to help decrease the redness and inflammation, and helps to exfoliate as well.
Thank you for joining us today. And I'm trying to take mental notes as you're talking, but I might have to rewatch this segment so I can make sure I get all that information. Hey, we all struggle with it.
Oh, absolutely. So many people, well over 80% of people have acne.
You should see the amount of concealer I have to put on this face. Thank you so much, Doctor.
It's my pleasure. Well,